To ensure the 6 rights of medication administration, first review the medication order. It should include the patient's full name, the date the order was written, and if applicable, the date it expires, the drug's name and dose, the route and frequency or timing of administration, the reason for administration for a PRN medication, and the prescriber's signature. Now observe the 6 rights, starting with the right medication. When a medication is first ordered, compare the prescriber's written order with the medication administration record, or MAR, or with the computer's order screen. When administering the drug, compare the label in the drug container with the MAR 3 times. Once before removing the drug from the drawer or shelf, once before placing the drug in a medicine cup or taking it to the patient's room, and once again before administering the drug at bedside. With unit dose medication, leave the medication in the blister pack and perform the final check before opening it at the patient's bedside. If you must prepare a dose from a larger volume or strength, or if the prescriber orders it in a system of measurement that's different from what the pharmacy supplies, calculate the dose or conversion carefully. Next, make sure you have the right dose.
Hi. Hi. Could you verify this drug calculation for me?
Sure.
Ask another nurse to do the same calculation independently. Then compare your calculations.
This is what I got.
All right, great. Thank you.
Thank you.
To help ensure the right dose, prepare it using a standard measuring device, such as a graduated cup or syringe, and follow these guidelines. For a liquid medication, hold the medication cup at eye level. Ensure that the cup is held level while pouring the medication. Pour the medication away from the label to avoid drips that may make the label hard to read. Then make sure the poured dose is even with the base of the meniscus. For a medication drawn into a needleless syringe, draw it in slowly to prevent air bubbles from entering the syringe. Air can displace the medication, producing an inaccurate dose. Then place a completed medication label on the syringe.
Hi there.
Hi.
How are you today?
When you're ready to
Good.
administer a medication, ensure that you have the right patient using 2 identifiers. For example, check his identification band, compare with the MAR, and ask the patient to state his full name and date of birth.
Pretty good.
Do not use the patient's room number for identification.
Can you tell me your name?
Yes, Raymond Kenneth,
And what's your birthday?
May 29th, 1956.
Great.
Next, ensure that the medication is for the right route based on the prescriber's order. If the route is missing, or if it's not the recommended route, consult the prescriber immediately. For an injection, be sure to use only a preparation intended for parenteral use. Injection of an oral liquid can cause serious adverse effects. To prevent this problem, remember that parenteral medications are labeled for injectable use only. To observe the right time, follow your facility's recommended schedule for medications ordered at frequent intervals. For instance, give routinely ordered medications within 30 or 60 minutes before or after the scheduled time.
Hi.
Hi.
How are you?
Fine, and you?
Good.
As needed, use your nursing judgment about the
Can
timing.
you tell me your name?
Yes, Raymond Kenneth,
And your birthday?
May 29th, 1956.
Very good.
For example, if a drug must be given with food, administer it within 30 minutes of the meal. Also, give medications at specific times as prescribed. For example, give a stat drug immediately. Administer a drug ordered for now as soon as it's available, usually within 1 hour. Give an on-call drug when the operating room or treatment area requests it. Provide an AC drug before meals or a PC drug after meals. Give a PRN drug according to circumstances or when needed. Finally, observe the right documentation, recording your entry as soon as possible after giving the drug, as shown in the video skill, Documenting Medication Administration.
Hi.
Hi.
How you feeling?
Good.
Good.
As part of your follow-up care, teach the patient about the medication and continue to avoid medication errors, as shown in the video skill, Preventing Medication Errors.
I wanted to tell you a little bit about your Fiasol since it's a new medication for you. You might notice that your stool is a little darker. You might feel